Okay, so you're all very welcome again today, and we're going to start off today's session with a presentation from Dr. Raymond Bond, who's from Ulster University, and Raymond's going to be talking about citizen science, motivating young people to contribute to science. So thank you for that, Raymond, and off you go.
Many thanks, Siobhan. Hopefully everybody can hear me okay. Yep, great. Okay, so I'm not actually going to provide any answers today, but it is an interesting topic because I'm not an expert in citizen science, but it is certainly relevant, I think. And I think what I'm leaving you with is a really important question, which is how do we create better opportunities that allow our young people and younger citizens to contribute to science and indeed mental health science. I should say that I'm from a computing science background and data science, and I'm not a psychologist or mental health expert. So again, as I said, my presentation is fairly primitive, and I would start out by defining what science is. And I think when we go through education, we're often taught to retain knowledge. And I think when we move into science, we're taught to create knowledge, and there's certainly a divide. And I think that's a bit of a barrier to citizens, because there is an assumption that we must be great retainers of knowledge to do science. But actually, science is about knowledge creation. And going through my own education, memorizing concepts or ideas or names or dates is difficult. But that doesn't mean that I can't do science or that anybody else can't do science, because science is about asking questions, and it's more about asking questions than it is about remembering answers. And of course, as Einstein famously said, imagination is more important than knowledge. So I think there's an opportunity to really try and engage citizens in contributing to science by creating their own research questions and also engaging in the collection of data. Now, when I was reflecting about this talk, I took myself back to Sunday school, actually, where the story of Noah's Ark was being told. And I did actually put my hand up and ask a silly question, which was, would the earth flood without gratings? And that was me as a young child of 8 or 9 years old. It's not a good question. It's not necessarily a scientific question, but I think asking lots of mediocre questions is often a necessary precursor before asking a useful one. So I always try and encourage myself and my PhD students to develop the habit of asking questions, because whilst, as young children, I have a 3-year-old and a 6-year-old, all they do is ask questions, and some of them are very stimulating, because if you open up the encyclopedia, I get questions like, why is the sun in the sky? Well, I don't know, and that really forces us to come up with answers or to do an experiment. But for some reason, we lose that inquiry-based learning, and we move into memorization. And so we need to find ways to increase the scientific literacy amongst ourselves, but also certainly amongst citizens, because I think citizens, certainly frontline end users or people who have lived experience with mental health, know the real issues and actually have their own research questions, but they don't always share them or know who to submit those questions to. And as I'll mention in a minute, I think a lot of researchers, well, myself, I don't always have the right perspective or the right empathy for a certain application area. So you'll see a number of quotes in the presentation. Some of them are just my favorite quotes. Confucius said that the person who asks a question is a fool for a minute, but the person who does not ask is a fool for life. And that does remind me again of going to primary school, because my mother always told me to put my hand up if I didn't know the answer, or if I had a question. But of course, I always felt really brave doing it. And no matter how silly the question was, I was always the person to ask. And of course, there's another great quote that it's easier to judge the mind of a person by their questions, not their answers. So science, as we all know, I imagine, is about asking questions. And sometimes we'll have to ask mediocre questions before we ask a really good research question. But I do think that citizens, this idea of citizen science, I think citizens can generate a lot of new hypotheses and provide lots of new perspectives for new research questions that researchers themselves might not have ever thought of. So what is citizen science? This is where members of the public contribute to science from, it can include things like data collection, hypothesis generation and analysis. It is a similar concept to patient and public involvement. And there's many examples of this. One example is participatory sensing, where you might ask citizens to take photos of certain plants or trees as they're out in parks. If you wanted to collect a lot of data to, let's say you were doing some animal surveillance or some other type of surveillance for data collection. And I'll show an example of that in just a second. Crowdsourcing is well known. You might have heard of Amazon Mechanical Turk, where that allows human computation, basically, where humans are given tasks online, let's say to identify chihuahuas from dogs, or to label photographs, or to identify oil wells from satellite images. All of that can be done through a crowdsourcing platform like Amazon Mechanical Turk. But I also think just general feedback and insight. For example, there's a lot of digital health apps out there. I'll mention later that 28% of those are mental health apps. And I think, you know, citizens and certainly young people can go on to app stores and provide their feedback, their honest feedback. If an app isn't working for them, well, why? You know, that app might have been developed by a research team or a research project. We need to facilitate or encourage users to provide that feedback on app stores, because data scientists like myself and many others can engage in what's known as review mining, where all of that feedback data on app stores can be mined using computer programs, and the topics and the common themes can be automatically pulled out of those large corpus of text. The example that I came across this morning was the example of citizen science. I think it's a good example, is Saving Scotland's Red Squirrels, where citizens are encouraged to take photographs of either a red or a grey squirrel in the park. And as they take the photograph, they can submit that photograph to this online system, and they detail the geolocation. And if you go onto this website, you'll see that you can actually see the geospatial visualization of red and grey squirrels across Scotland. And you can see some other really nice data visualizations as well. This is another, I think, good example of citizen science. And there's no reason why we can't be creative and think of something that's relevant to mental health. And so I think we shouldn't be afraid of encouraging amateur science, that is, encouraging everybody to contribute to science. Because, for example, I've come across this fantastic quote from Woolf, that is, if being a generalist was the path to mediocrity, then why did the most comprehensive study of the most significant scientists in all of history uncover that 15 of the 20 were polymaths? And for clarity, a polymath is somebody who has many interests in many things, and so their interest in a particular topic, they may not be an expert in that topic, but that didn't stop them from contributing to the science of that topic. There are, of course, many challenges to citizen science. One is that we often use academic language as researchers, and I was going to even put my profile that's on the Ulster website here, but I was too embarrassed, because the point that I want to make is that even the language that I have used to convey my profile is not that accessible to everybody, because I talk about healthcare informatics, I talk about human-computer interaction and data science, but maybe a lot of that doesn't mean a lot to a lot of people. So we need to make our profiles a bit more accessible. I think we need to be more, certainly for myself, I need to make myself more approachable so that people can send me emails and submit their ideas to researchers like myself and others. And so I think this thought I mean, again, this presentation is just a series of thoughts. But part of the thinking was that I realized that a lot of my research involves applications of technology to healthcare and mental health. But of course, I'm not a mental health expert. And what I realize is that whilst I'm involved in teams that create digital mental health products and so on, we may not have kind of very much representative empathy for the end user. And I think we may not have the right perspective or the right research question even. And so allowing or facilitating environments that allow end users and people who have lived experience to actually write down their scientific research questions and submit them and open them up for discussion, because I don't think that we all feel at liberty to do that. And so citizen science can go beyond that again, because whilst we have heard of open data, for example, open data is where a data set is made available online for any citizen or anybody to use and to analyze. I think even open data has a barrier because not everybody can use SPSS or analyze data. But there is a move towards open dashboards where, for example, you've seen the COVID dashboards that have been available. Any citizen can analyze that and interrogate the data for themselves. Now, of course, that comes at a risk where people might misinterpret some data and disseminate misinterpretations of data visualizations. But it is a good opportunity, and one of our PhD researchers is currently working on that idea, where he is creating a dashboard to allow any citizen to interrogate GP drug prescribing behaviour in Northern Ireland over the last number of years. So that allows anybody to come up with their own investigations or research questions that they can answer themselves using a very much user-friendly data dashboard. So that's just a series of thoughts. I'm not an expert in citizen science, but I think it's an interesting idea. The remainder of my time, I just want to mention a project that Ulster is coordinating called Chatpal. In Chatpal, we have created our first chatbot, and we're developing it further. But this chatbot is for everybody. It can be used by young people or older people, or it was specifically developed for people living in rural areas. But the chatbot is a positive psychology chatbot. It basically converses about this idea of PERMA, which was created by Martin Seligman. PERMA, we have designed our content, our chatbot content, around PERMA. That is, that we have content to encourage positive emotions amongst the users, to encourage engagement and better relationships and more meaning and ambition in life, but also to monitor and track health using mood logs and so on. So please do go and read more about this chatbot, and even download it and use it. A chatbot, if you haven't heard of it, it is just a way for somebody to have a text conversation with a computer. So it means that you're not using an interface, you're not engaging with a cumbersome set of menus or navigation items. It is a natural conversation, so it is arguably more user-friendly. And there are some thoughts around perhaps a chatbot might allow people to open up sooner when compared to talking to a face-to-face to another person, because it removes some stigma, it makes it less judgmental, and so on. And of course, a chatbot is available 24/7. We did design this chatbot using a stakeholder-centered design approach. So we did involve citizens. We did involve different types of groups. So we involved mental health professionals as well as citizens and users. The reason why we call it a stakeholder-centered design approach is because we realized that we shouldn't just design a chatbot to meet the wants and needs of citizens or end users. We need to balance that with what kind of chatbot mental health professionals will endorse. And we also need to balance that with what AI technology can do well, because there's no point in providing a technology that people want and mental health professionals will endorse, but the AI technology can't cope well enough, and you get lots of errors, and then that really does affect the user experience. So we did actually carry out a survey with lots of mental health professionals, and we found that they would support a chatbot that provides psychoeducation and coaching and some training and self-management, but they wouldn't endorse or support a chatbot that provided diagnostics or screening, or they're less likely to endorse a chatbot like that. These are some of the activities that we carried out in ChatPal, and not go through them all for the sake of time. But we did take the needs from workshops from end users. We did take the needs. We did carry out a design thinking workshop where stakeholders and experts and professionals put in some of their thoughts as well as the user needs that we had collected. We then independently voted on those needs as a consortium, independently and anonymously, and we were able to then rank them and cluster them into basic requirements for the chatbot, so we can actually create a chatbot that is stakeholder centered in that sense. Some of the other work that we're involved in is the Inspired app, which you might have heard of. It's an app that allows older people to reminisce, and indeed people with dementia to reminisce using photographs, sounds, videos, and other content. And there probably is an opportunity here for even young people to get involved. And this was a scientific project, and there's an opportunity maybe for younger people to get involved, to maybe even populate the content of an app for their grandmother or grandfather. And so there is an intergenerational element, opportunity here. Also, in this work, we have used what is known as ecological momentary assessment, which is basically, as somebody uses the app, you get pop-up questions every so often, which very simple pop-up, just one pop-up question that people can answer in the moment, basically with one touch, one tap. And that's scientific data. And ecological momentary assessment is a really good method to collect citizen data, and it's very convenient for citizens to submit that scientific data. And so we're doing quite a bit of a number of experiments with that. So that's probably the end of my presentation. And just to mention that we do live in an age where we have a lot of digital health apps. And as I said earlier, 28% of those apps are actually mental health apps. But we also know that user retention and use of these apps is a problem. So you can lose almost 95% or 90% of your users after 3, 4, 5 days of the app being released, simply because people are not engaging. But why? Some of these apps are developed as part of research projects, but why are end users installing them and then deleting them just after a number of days? Is it app fatigue? Is it because the app is not as useful, or there's no peer support in the app? So we need that citizen feedback on the app stores, and indeed through co-production or collaboration with researchers at Ulster or other universities. And so I think the real question is how do we create better opportunities for young people to contribute to mental health sciences? And I haven't answered that question because I can't, but it is an open question for everybody present. And hopefully some of you have great ideas to try and address this question. Thank you.
Thank you so much, Raymond. I have a mobile phone full of apps that I never use, and every so often I do a big sweep, when there are mental health apps in there as well. So yeah, the involvement of academia is essential, but the involvement of the users and people with lived experience, I think you start by listening to what people want. That's the first part of it. And those theoretical frameworks, theories of change as well, can be very useful in the creation of something that's actually going to make a difference and will be used because it's making a difference. Is that you in that last slide, Raymond? Is that?
Yeah, it is. Yeah. I was at a museum somewhere, and I thought I would take a selfie with me and some AI computer.
I would doubt that anybody will have a better picture today in their slides. Now that's just fantastic. It looks really techy. It's really good. It's probably taken on a phone too, was it?
Yeah, it's a bit geeky.
No, I love it. I love it. I love it. Brilliant. So that's been very useful. Lots of food for thought there. And certainly that's one of the things that we want to try and do with the work that we're doing, is to make opportunities and create opportunities and make sure that young people are involved in mental health research, and also make sure that we create things that are meaningful, that will work for young people. I think our next presentation from Soo Hun is really, it just aligns very nicely and it flows very naturally from your presentation. And Soo's going to tell us about the app library in the Department of Health and what's on offer there. And this is fantastic because you've put really so much work into this, and it's something we need to, discuss more and highlight more and promote more. So hopefully there'll be an opportunity there to do that, and all of you will support the work that Soo and her colleagues are doing. So I can hand it over to you now, Soo.
Thank you, and good afternoon, everybody. I don't know whether you can see me very well. I didn't. Kind of with lockdown, I don't have a ready-made kind of nice picture in the background of the bookshelves, only the ceiling. So I've been doing standing meetings to try and get my mental health and physical health back in shape again. So I'm just going to share my screen. I'm going to flick through between the internet and then back to the presentation. So again, excuse me if I kind of am clunky with the digital piece, but hopefully you'll see why I'm trying to do that. So I'm going to talk a little bit about. I'm going to share screen first, get the technology right. Okay, can everybody see the presentation? Can everybody see the presentation all right?
That is perfect, Soo. Absolutely okay. Lovely.
That's great. So, again, thank you very much, Rhonda and Siobhan, for the opportunity to come and speak to yourself about it. I'm Soo Hun. I'm actually wearing a number of hats. My main role is really innovation and digital ecosystem lead, really big mouthful of a title. But really, the role I have is really kind of look at how digital could be used for innovation, how digital can enable and support innovation. And then the ecosystem really is about talking to people like yourselves, talking to people from the universities, industry, about what opportunities there are for us to kind of do things in terms of digital, both within the system and outside the health and social care. So those are my details there. I don't have maybe I should try and get a fancier headshot looking at Raymond's, but I just got a standard one. That was actually taken at a hackathon that we ran in Ulster University about a year and a half ago. So really wanted to talk about, dovetailing really nicely into Raymond's bit about use of digital mental health apps. Whenever I went to look at reports and seeing what was the kind of trends for apps use over the whole lockdown, we found, not surprisingly, that because of all the things that's happened, people are having to do a lot of things by themselves. App searches for key mental health issues rose quite dramatically, and you can see the numbers was quite stark. Searches for depression, 100%, OCD, 400%, stress, mindfulness, 2,000% increases, and not just actually from the citizens themselves, but actually from healthcare professionals, because they're no longer able to do the things that they were able to do previously. They've had to go and look at alternative ways of delivering the care that they used to do previously. So that's kind of the stats of where people are behavior-wise in terms of looking for mental health apps. Then when you look at the concerns on the flip side, what's available on Google and iOS, the biggest worry is, despite there's so much of these kind of progress and new apps emerging every day, majority would actually fail ORCA reviews process. So ORCA really is an organization whose bread and butter business is about reviewing. ORCA stands for Organization for Review of Care and Health Apps. So their role in life is actually just to review health and care apps. And the reason why is because healthcare professionals will be very unwilling to recommend apps that they have no knowledge of, that they can't stand over, because of all the regulatory issues, because of all the kind of clinical, safety issues. So really, ORCA's doing us all a very big favor by looking at the apps and trying to review them on a few areas. So the 3 areas that ORCA review things on any apps is really on the clinical assurance, on the whether any professionals were involved in the actual review of the apps, looking at it from a usability, how much of the apps was designed with usability in mind with the end users. Did it use, again, like Raymond, did it actually co-create or co-develop the app with end users? And last but not least, the actual data privacy side. So how transparent are the app developers on when they collect your data? What did they do with your data? How well or how secure they store your data? What rights do you have over the data that they store for you? So how transparent are they whenever they actually collect the data for yourself? And as you see from the recent, cyber security events and things like incidents and things like that, we are increasingly more aware that, that how we offer our information out to quite easily, but we actually have very little understanding of how well the app developers themselves are actually retaining or storing our data in order to protect us from some of these kind of cybersecurity incidents. So these are the things that we would like somebody else to look at, and these are the things that ORCA does in terms of the review process. So as you can see, whilst there are lots of apps, only a third score above the baseline of acceptability, which is 65%. Anything below 65%, they don't consider them as good enough. And so for some of the specific apps, if you can see, 14% actually of the OECD ones pass muster. That's like less than 1 in 5. 20% for bipolar, and the more kind of clinically more sophisticated, complex mental health conditions, the less likely those apps actually pass the score, because they have not been either developed with clinical people in mind. So it's really important for us to be able to discern the apps that are really good and does what it does on the tin and actually safe for us to use and trusted, versus those that are just out there and you have really no idea what they're actually trying to do or tell you to do. So in response, at the early stage of the lockdown, we built an apps for healthcare HSCNI.net library. And this was because we realized that at the very onset in about May, this time last year, that many people will, again, both clinicians and the citizens, public, will have difficulties trying to find resources to help themselves. But so we thought if we could at least avail of that, that means people could actually go and look for it themselves. And as it stands, the library has 4 tabs on mental health, fitness, nutrition, and sleep. We are going to surface more in the future, but these are the 4 main ones that we've got there. And if you go and look at the mental health tab, there are at the moment 187 apps out there, and these are the ones that have actually been reviewed. So despite me talking about thousands of other apps, the selection that we have for mental health is actually quite a healthy selection of apps. And I wanted to just tell you a little bit more about of those apps. While it's huge numbers, which is good, but it's obviously quite daunting to go and find the right apps that you want to use. So I thought it might be useful to just tell you a little bit about how we can filter, and then I'll demo it to you in a minute. So if you could either filter on the library using on the cost, on the platform, and design for. So I'm going to go into a bit of detail. So on the library, you'll have apps that are free, or with in-app purchases, or paid. And they come in different, obviously, from iOS, Android, and actually web apps as well. And as you can see there, of the 187, we're actually quite good. There's quite a huge amount that are actually free at the point of use. And then obviously another amount for in-app purchases, which means you only need to buy. Sometimes it's about trial period. Sometimes it's about in-app purchases are about, only for certain features. If you want more, then you pay and you get them. And then obviously the rest are for paid. So there's not a huge amount that are paid apps at the moment. Web apps are a new category of apps. They're now apps which are, no longer require you to download. They're not iOS or Android. They're, context sensitive. They'll know whenever you you go and browse on your phone, whether it's what kind of browser that you're using, whether it's on a tablet, a computer, or a phone. And basically, that means you have less things to download or update on your phone. And it means that you also less storage that you require on your phone in order to use those apps. And they are now also part of the review category that ORCA has commenced recently. Then looking at the population, who is it designed for? Again, they have it for either everyone, but they also classify them by teens, preteens, and children and adults. And again, looking across free and in-apps, and again, the numbers are more manageable from what you can see there. The smaller numbers for preteen, a bigger number for teens and adults, and then a small number for children for obvious reasons again. And again, mainly for free, and apps are the ones that are in use. So I picked a category. Another one that you could filter by is by category. So I picked one that's quite common, which is anxiety. And when you click the category for anxiety, you get something like 104 apps, which is again quite a lot, substantial, but of which 39 are free, and then 64 are obviously with some sort of purchases. 55 of them are on Apple, so it's kind of half on Apple and Android platform. And then I wanted to kind of introduce you to some of the levels. So again, ORCA reviews the apps based on different levels as well. And you can see there's level 2s and level 3s and level 4s. So level 4 is really the highest level, and it requires the most rigorous kind of regulation, because basically a level 4 app actually makes kind of clinical decision and tells you what to do based on the data it receives. So it needs obviously clinical input, and therefore it needs to have a tighter regime to ensure that the information it's advising or giving out or are actually really supported by the evidence. So a level 4 app is really like a medical device, it's really kind of highly regulated. And then level 3 is slightly less, and then level 2 is kind of mainly more for general health and well-being. It doesn't really specifically tackle a particular long-term condition or mental health condition. It's going to be more generic health and well-being. So in terms of that anxiety ones, there are about 12 that are slightly higher level, more specific, disease specific, and then 8 are highly regulated, and then the rest are all at level 2. And you'll be able to see them when you go and review the apps. Then I wanted to pick up some more specific ones, say, for example, on eating disorders. And again, I found there are 4 apps in total. Those are the 4 there. All of them are free. Again, to equal on the platform. And then again, really delighted to see that they're obviously, some of them are actually at level 4. So again, they have clinical input, evidence-based, all the kind of right things that are governing the app at the point of development. Self-harm prevention is another category. Again, I did a screen dump of that. And again, there are 6 apps in total, mainly at level 2. 4 of them are free, 2 with in-app purchases, iOS and Android. And again, I wouldn't be able to go into them in detail, but be happy to chat about how we could do that and work with yourselves in terms of understanding better which are the apps that are actually suitable. Then in terms of the actual, when you click on the app itself, and this is what you'll see eating. So I've taken the example of the eating disorder one, and you'll see the developer is somebody called Recovery Record. And they actually have their user website on the developer description piece. You'll see a score. So again, that gives you an idea of out of 100, how well they have scored in terms of the 81%. Usually it's a level 4, so it's got the accreditation. It's Android, in this particular one is Android, entirely free, and it was last reviewed in March 2021. So you'll know that the app isn't, although it's been released for nearly 10 years, it's been constantly kept updated because the last update was in March 2021. And the origins is actually from the US. So this app is a US app. And then the other categories that it falls into, mental health, health diary, telehealth services, eating disorder. So you can tell, again, from the categories, what categories it falls under. This is a level 4 app, as I said. So you can see I talked about the 3 categories that it's reviewed under: data, professional assurance, and usability. Again, so you'll be able to go in, and you see the respective scores. So out of that 81% score, they got 71 for data privacy. They got 91 for professional assurance. So that's a really good high score. Usability and accessibility, again, how usable is the app. And again, you'll get details about, the design, and does it have compliance with apps design, user engagement, but they can find evidence of user testing, but they can't find evidence that involve user feedback. And professional assurance, again, you get the detailed breakdown of each of how they got their scores, what they did comply in green, and what they don't comply in red. So that's, again, so much more information that you could get out of the library that you wouldn't be able to get just out of a review from a Google store or iStore, or even the description that you get from the very, very brief description that you get from going to the store. You can go into this, look at it first, and then decide to go to the store to download it once you've had the reliable information here. And this is all independent evaluation. Function and features, again, it just tells you for that one, it has online consultation, obviously not maybe appropriate for us because this is US based. It has goal setting and gamification. It does share data. It does have data capture. It does have condition match. So again, you get a very a good idea of what the app actually does. And one of the things I didn't put in is actually the snapshot. There are galleries of all the pictures. It can show you what the app looks like again before you actually go and download it. And then this is the actual record of the website that who they are, and they are offering it worldwide. And so you can actually read more about the company that has developed it, so that you're armed really with information before you go and download the app, rather than just go in and just read the reviews, which sometimes the reviews and really may not be fully genuine as well. So last but not least is really just want to kind of talk a little bit about maybe what we can do with the apps library. So the feedback on the use of the apps is that we would like to get feedback, as Raymond said, usability, does it do what it says? Although it might score really highly on the usability, does it actually do what it says on the tin? Are there things that you like about it, and does it, things that you don't like about it? Something about user retention, again, whilst we can tell you to download the app, we don't really understand how we would like to understand better how people are using the apps, whether you use it for 6 months or 3 months or less, or infrequently or more frequently. We would like to also find out from the library as well. It gives us an insight on where any new apps that have come about that we're not aware of, any gaps, any opportunities to develop apps that are not already on the library, because there are things that maybe nobody has thought about, but yourselves or young people feel it's really pertinent to managing mental health. So again, it gives us opportunity to co-create and find new ideas. And then again, linking it with citizen science piece, the app is there, all the library is readily available, is kept up to date. Any apps that are no longer available or no longer updated, you can see from the last update, it will more than 18 months or 24 months, they'll be taken off the library. So I don't have to look after outdated apps. The ORCA will look after that for me as well. So that's just kind of what we could do with the resource that we now have built. There are lots of opportunities for us to tap into that a bit more. Just one last thing I want to do is to just show you the library itself, so you get to see it. Let's see. Go into... Yeah, so this is the library. So this is the demo of the library. So when you click mental health, when I talk about all the filters, they're all here. The cost is here. You can see where the cost is. You can filter by the platform. You can filter by the categories: adult, children, clinician, everyone, preteen, teens. You can filter by country of origin. You can filter by function and features. And the categories I talked about here is you can filter by the categories here, go into the mental health piece. Yes, and then you'll be able to see OCD, insomnia, eating disorders, depression, bullying, BPS, BPD, bipolar, addiction, self-harm prevention, suicide prevention, anxiety, loneliness, panic attacks, stress. That gives you 112 altogether. Huge list. But then you can then start to, it'll be organized in the highest score, obviously first, so 88 score, entirely free, level 2, types of platform, and so on and so forth. Some of them have COVID kind of notation on it, because it basically tells you that there's something there that is about COVID related, that they might actually give a trial offer, or they've been through a further testing because of COVID, to make sure that's fit for purpose. So that's all I have. Hopefully if you have any questions, feel free to pop them in the chat box, or we can talk about it later at the Q&A. Sorry for running through it really quickly.
Thank you so much, Sue. That was fantastic. I think we still need more awareness about the apps library. It really is brilliant. The idea of Northern Ireland has this resource, and lots of people are looking for help, and some of those apps are actually, they're really, really good. So it's worth spreading the word on our social networks and our social media as well, to let people know what's there. And it does worry me, because we know that a lot of online content regarding suicide and self-harm is actually very unsafe. So I think, mental health generally, it's important that the apps are curated in a way that recognises there's safety issues, but also particularly for suicide and self-harm, that there's some level of scrutiny there. So that's absolutely fantastic. And as I say, we used to think it was just young people, who use technology, and now with the pandemic, well, not use technology, but live their lives through technology and through their phone and through their devices. But actually, we're all doing it more and more now. So hopefully, the pandemic has increased the traffic to that site as well, and it's going to, increase the use of these kind of interventions. But we know they're no substitute for the face-to-face stuff, but they can be very, very useful alongside other types of interventions and other types of therapies. And my response to the strategy on Action 13, it was about digital health interventions. I think we can be a lot more ambitious in that whole area and work, integrate technology in very, very novel ways to support mental health services and to save us money too. And I know you said.
Yeah. Yeah, when we ran some useful hackathon, for example, that was really useful in bringing young people together, both from as a developer, but also engaging with other people about ideas, and that's really a really raw way of getting ideas and prototypes and listening to both the problems from healthcare professionals as well as ideas from young people. So I'd be really seeing keen with my innovation hat on to kind of be able to do these sort of more of these sort of ways to engage with young people and hear their voices. And even as Raymond has said, with chatbots and Alexas and other things, is that the way that we should be moving on, or are they actually other things? Like I've dabbled into virtual realities, augmented realities, and other types of technology. So they are all the opportunities for digital, which obviously young people are excited and enthusiastic with, and we want to really hear from yourselves about those ideas that we can then. So otherwise, it would not be relevant for yourselves in the next foreseeable future. So yeah, definitely, I'm more than happy to hear ideas from yourselves.
Brilliant. And VRs, yeah, I'm aware of a few projects happening in Northern Ireland using VR for various elements of mental health and well-being. Tackling various issues there. Really, really exciting. Okay, so super. Thanks again. Thanks for joining us today. So really, really welcome your contribution. Now we've got Niamh Mallagan from Northern Ireland Youth Forum, who's going to be talking to us about using your voice and how to use our voices, and particularly young people, hopefully. So Niamh, are you there? You are. I see you on the screen now. So I'll let you get started.
Thank you very much. I hope you can hear me all right.
Your slides are looking great there, Niamh. Yeah.
Great. Lauren's going to be in charge of them, so if you hear me say next slide, that's why she's swapping them for me. But yes, thank you for having me. So yeah, our presentation today is from Northern Ireland Youth Forum, and it's about our Voices campaign and our latest piece of research on speaking truth to power. So who are we? Well, Northern Ireland Youth Forum was established in 1979, and it really just wanted to promote the voice of young people in society. And it's a youth-led organisation. We're run by an executive committee, which I'm currently on, which I'm very grateful for. And we're for young people aged 11 to 25. And we basically give them a platform to lobby and campaign on issues that affect their lives and that they think decision makers need to hear young people's voices on. And we work on a wide range of things, from mental health to promoting voices like this in coronavirus, to Fight to Unite programme. There's such a broad range of things that we do, and it gives people the opportunity for residentials, international travel, training, etc. And what's most important to us is that young people drive the agenda, and we find out how to address the issues that are most important to them. So next slide, please, Lauren. Okay, so the Our Voices research. This basically arose because young people felt that their voices needed to be heard in relation to the COVID-19 pandemic, and that wasn't happening. Obviously, so much was happening whenever it first came about, but young people shouldn't be left out of that. So it was important for us to engage directly with the young people and hear about what their key issues are during all of this. So in total, we've done 3 pieces of youth-led regional research. Almost 4,000 individual responses, about 1,065 were for our latest piece of research, the Speaking Truth to Power. We've identified the top issues for young people in this time, and we've managed to get quotes from them, their views on certain things. We've got plenty of statistics. Our reports are looking great. And that platform was really created so that young people had their voice with decision makers, and they were able to hold them to account. Next slide, please. So our top issues that were identified by young people, the first 2 were mental health and wellbeing, and then education, which I think is a no-brainer, honestly, because those are the things you hear all the time. Not only with mental health, obviously, is not only with young people, but education was one thing that so many young people were confused on and didn't know what was happening necessarily. And then we have isolation and loneliness, boredom, and physical health as well was a major one. Next slide, please. So mental health and isolation. 74% of the respondents highlighted that they felt their mental health had gotten worse during the pandemic. Only 11% said that it had improved, and this we found was for loads of different reasons. Maybe they got more time with family, maybe they found that their learning environment was actually a bit better for them because they hadn't been able to get the full services in-person teaching. But I think it's massive that 74% were saying it got worse and only 11% said it got better. And only 29% of people really felt hopeful about the future. And I think that comes about for so many different reasons, such as feeling like they can't be motivated to attain the grades they want in school, or whether it's they just feel like the pandemic's never going to end and they're not being heard and their voices aren't being taken into account. And it's just a really stark figure there to see. 52% felt that they were not coping well with not seeing family and friends, and that's where the isolation and loneliness comes in, which so many people think is just an elderly person thing, and obviously it's a massive issue for the elderly community, but for young people as well who don't have cars and transport and can go out and maybe do things by themselves. It was very difficult for them as well. And then at the time of the survey, young people were asked to describe words that about how they felt about the whole thing, and the top 3 were anxious, annoyed, and frustrated, which as a young person myself, I can say is most definitely how I felt during the pandemic, especially not being heard and not having our issues at the forefront as well as everyone else's. Next slide, please. So the key issues with regards to mental health. Underfunding and access to vital services, CAMHS waiting lists. These are all things that were an issue before the pandemic, but have just been times 100 because of it. And then the impact of COVID in general on people's mental health. The fact that people can't get out and see their friends, the fact that they're stuck inside staring at a computer screen all day, it does really change the way that your brain works. And then recognition that loneliness and isolation are experienced by young people also, I've already mentioned that. And greater moves needed towards challenging the stigma around mental health and embracing a mental health curriculum in an educational setting, as suggested by the Elephant in the Room campaign, which we are still plodding on ahead with that campaign, and this research has definitely helped with that too, but we're just looking for more funding and more help in regards to that. So that's kind of where we're at with Elephant in the Room at the moment. Next slide, please. So other considerations as well. 10% of young people felt that whenever they completed the survey, that the key issues, including food, feeling unsafe in their homes, housing rent and homelessness, weren't really being amplified as much, because no one really thinks, oh, a young person, they're going to be worrying about housing rights or anything like that. And the amount of young people who maybe were able to just go out, be with friends, be in school, and maybe they just didn't feel as comfortable in their home setting, and then all of a sudden they were just told, well, that's all you can be in for the next however many months. And then so many, we have a homelessness campaign in the youth forum, and a lot of them were saying to us, like, there's no real consideration being taken in about how this is affecting them during the pandemic, and just the help's not really there for them. Lack of access to do physical activity and engage with others. So if you can't go out and go for a run or something like that, maybe you depended on team sports for your activity, and all of a sudden that's gone, and that completely banjaxes your mental health. Whether that's self-conscious because of how you look, or maybe it's just that you're not getting those endorphins that you were getting before. And as it says there, the UNCRC article that was infringed upon is Article 21, the right to play and access to green spaces, socialising with friends and family. And I think it's just such a massive consideration for people's mental health, and just for people in general not feeling isolated and stuck at home. Young people also identified concerns around the health of those around them, and really felt a responsibility for how people were reacting, I suppose, because like whenever young people were forced to go back into schools, maybe they didn't want to, and maybe they felt unsafe in their educational environment because of the pandemic, yet they were going back in, and then everyone else was saying, oh, well, it's young people's fault that the numbers are going up, the cases are going up, and they felt that responsibility, and it wasn't a good responsibility to put on young people, basically, because it doesn't help their mental health. And then there's the pressures of homeschooling, no motivation, greater exam stress, confusion, considering I don't think anyone truly knows what's going on with exams and stuff like that. So they were told there were no exams, and then yet they had tests in school that are going to go towards their grades. Young people have been away from their normal for over a year, so no routine. I'm feeling that certainly I'm in university, and my lack of routine has completely skewed my education, because there's no solid sort of physical having to go to class, and you really can fall behind sometimes. And then developing the capacity of young leaders and new opportunities to engage as communities. So a lot of young people have been stuck at home maybe and not able to do stuff, but then other young people have had the opportunity and have taken the opportunity to help their community in big ways. So like going out and helping in food banks, going out, buying their shopping for their elderly neighbours, stuff like that. So there's so many community-led youth groups that have really done a lot for their communities, and there needs to be more emphasis on that. Obviously, we can say our research was youth-led, so that was a big thing in the pandemic, and getting young people that voice through that. But so many things closer to home, and groceries, getting people food, massive help. And then what has gone unnoticed or missed due to the pandemic and restrictions, like how many people have maybe suffered more consequences because they're at home and no one's able to see how that's affecting them. There's so many different ways that people have been affected. Next slide, please. So yes, youth voice and participation. 89% of the respondents felt that the voice of young people has not been heard during the COVID-19 pandemic. And a lot of them said to us that whenever they heard about this research, or whenever they saw our meetings with decision makers, they were like, that's incredible, and that's what we want, but we want more of it. 74% of survey respondents felt that they did not have faith and confidence in leadership from government, which I feel like a lot of adults feel that too, but it's especially prevalent whenever your voice isn't being heard, as well as not knowing what's going on with restrictions, etc. And then it says there 58 did not understand the messages from people in power, and 55% of respondents said they do not fully understand restrictions, rules and regulations. And time again, we have tried to get a youth conference set up so that there was information ready and available for young people, not necessarily all the complicated information that's going out in the news, but stuff that young people can understand very easily, and they can ask the questions themselves about their certain situation, whether that's education or mental health or isolation, loneliness, whatever it is. Next slide, please. So yes, our key issues here, as I said, there were some restrictions on the UNCRC, such as Article 12, right to voice. We have the right to be heard by decision makers, not only heard, but listened to. I feel like there's a difference between attending a meeting and people going, yes, congratulations, you've presented, and them actually going, oh yeah, do you know what, I'm going to help you doing X, Y, Z. And then the youth press conference, it's been cancelled once because of certain incidents within the Assembly, and we've asked for it again, and just there's no real push for it within the government at all, which is disappointing for us, because surely they should want to hear our voices as well as everyone else's. And then a long-term mechanism for young people to be heard and consulted upon. So there's things being put in place at the moment, but we want to see if those are effective working mechanisms that are going to continue into the future, where young people can be heard regularly and by people in high positions of power in the government. Next slide, please. So where have we got to so far? Here's a list of all the people we've met with and all the different things that we've done. And yes, these are all incredible. Meeting with our political champions, Kula, the Northern Ireland Commissioner for Children and Young People, Education Minister, Robin Walker, Niamh Mallagan, the Public Health Agency, Education Committee. There's so many things there that it's, as I said, fantastic. We love presenting and being able to show people what we've done, and be able to show people what young people are thinking at this point in time. But if nothing ever comes from that, then if we're not given like, oh, we're going to help you doing this or whatever, then it's not worth it on our books. We need actions. We need to know that people are taking into account the voices of young people as well as just hearing them. As you can see, there are 2 council meetings with Dan Dodds, which is disappointing. Multiple requests for a youth press conference. That hasn't happened. And sorry, someone sent a message into the group chat and I can't hear, or can't see the presentation anymore. But yes, upcoming meetings with Department of Health and First Minister, Deputy First Minister, all that kind of stuff, which is fantastic once again. Next slide, please. So my question to you then is, what are the next steps? What can we do next to support young people? What can you do to help us with our campaign? It's still our campaign, it's still, we're leading the way and getting young people's voices, but what can you do to help us, basically? And yeah, that's the presentation done. Thank you so much for listening, and I hope you've got something out of that.
Thank you very much, Niamh. Sorry, I was out there, so I missed the last wee bit of it, but the bits I did see were very, very useful. And as mental health champion, the work that you're doing is really important, because, you know, you're telling me what I need to be telling the others in the department, and the priorities for mental health services and everything going forward. So that's just great. Right, so take a breath now. The next presenter, and again, it fits really, really well, is Angela from the Department for Education. Angela is working on the Emotional Health and Wellbeing Framework in Schools, and she's going to tell us a little bit about that. So if you have some slides there, Angela.
That's great, Siobhan. Thanks very much. I'll just share my screen here. And let me see. That should be it now. Can everybody see that?
That is looking great, Angela. Thank you.
Okay. So as Siobhan said, my name's Angela Kane and I work in the Department of Education. Just want to thank you all for giving me the opportunity to be here today. And we're going to look at our recently published Children and Youth People's Emotional Health and Education Wellbeing Framework. As you're all aware, the issues related to the emotional health and well-being of our children and young people have come to the fore in recent years and indeed are becoming increasingly complex. And as Niamh pointed out in the previous presentation, this was even before we experienced a worldwide pandemic with lockdowns, school closures, and the inevitable challenge that this has and will continue to present. From our perspective in the department, we know that many educational settings are providing excellent support, often going the extra mile to give what help they can to pupils and their families. We do also recognise that collectively there is still much to be done, and we in the department are striving to ensure the educational settings and in turn the children and young people have the necessary support they need. So what have we done? In 2018, along with the Department of Health and Public Health Agency, we commissioned the National Children's Bureau to undertake research for us to inform the future development of a wellbeing framework. We asked Ncb to identify the main challenges to children and young people's emotional health and well-being, provide an overview of existing research in the area, identify duplications and gaps in current provision, identify the most effective practices and approaches, and then to make recommendations for a wellbeing framework. No mean feat. I would also like to flag the invaluable support of Professor O'Neill and her PhD student Nicole Bond in this research, as they provided significant support to Ncb throughout the process, and indeed Nicole's own research report was invaluable to us. Okay. Has that moved on? Sorry. To the next slide.
I don't know, Angela. It's just your title slide. Do you have other?
I do have, yes.
Sorry. Oh,
there we go. Has that moved now? Brilliant, thank you.
That's okay.
Okay, so turning now to the Ncb research. It will come as no surprise that the factors identified by Ncb as contributing to poor emotional well-being included the online world, which was the potential for online bullying, the pressure to conform to unrealistic physical and lifestyle expectations, as well as the risk of extortion and exploitation. Then they identified childhood adversities, including poverty, emotional and physical abuse and neglect. And finally, academic pressures due to increasing competition for university places and in the job market. Then they looked at what works. And what they found were 4 factors: an overarching culture of well-being within the educational setting, a skilled and supported workforce, universal prevention provision supplemented with targeted interventions, examples of targeted interventions including the existing counselling service and nurture groups, and finally, flexibility to tailor provision to incorporate structured and informal approaches and to draw on external expertise when required. Outside of the educational settings, Ncb also highlighted the critical role of parents and carers in supporting emotional well-being, particularly in building resilience from the early years onwards, and youth work in facilitating the building of good relationships with young people in a less formal setting than schools to benefit their well-being. Now we turn to challenges and barriers to supporting positive emotional well-being. And Ncb identified funding, in particular the reliance on existing overstretched budgets and lack of additional longer-term funding, a lack of practitioner knowledge and associated confidence to deal with emotional well-being, and the availability of effective staff training was raised as a specific concern, as well as a lack of time and resources to access it. Thirdly, engaging with parents and carers. And fourthly, referral pathways. For a child or young person needing specialist support, or indeed if staff require advice or guidance to better support a pupil. And fifthly, schools not knowing which organisations or interventions to trust and how to access or fund these. So now we'll move to the wellbeing framework. Having received the Ncb research report, we then set about developing a framework and engaged with a broad range of stakeholders, building on the engagement Ncb had undertaken themselves. to provide a set of proposals which we then presented to this group and others as part of the engagement process. The framework was published jointly by ourselves and Department of Health on the 26th of February 2021. And I would like to acknowledge our other partners, including the Public Health Agency, the Health and Social Care Board, the Education Authority, the Department of Justice, the Department for Communities, and perhaps most importantly today, the Mental Health Champion, Professor Siobhan O'Neill. An investment of 6.5 million annually has been provided by both education and health to support the implementation of this framework. We recognise that this is just a start though, and would flag that it doesn't include the funding for existing programmes such as Nurture. Rather, it is additional. Alongside the framework, we also published an easy read version which was developed in consultation with children and young people by the Education Authority's Youth Service and an initial implementation plan. So, turning now to the detail. The overriding aims of the framework are to ensure children and young people are empowered and assisted to understand and take care or manage their emotional health and well-being, that their needs are identified early and addressed effectively when required, to establish an integrated model that supports an early help, support and intervention focus on children's emotional health and well-being needs, and that ultimately fewer numbers of children and young people will require specialist intervention from mental health services. Then who is it for? The framework has been written for those working with children and young people in educational settings to assist them in not only recognising the emotional health and well-being needs in their pupils, but also in themselves and to avail of the appropriate support. The implementation plan therefore rightly covers interventions for both children and young people and staff. So turning now to our model within the framework, and this is really the core of the framework document and contains 3 elements. So our first one there is well-being for all, which includes a whole child, whole school, whole community approach to the promotion of well-being. A holistic and integrated approach that recognises that a child or young person entering school feeling happy, healthy, safe and connected to their educational setting is more likely to fully engage with their learning. And for those not feeling that way, it ensures support is provided. That parents and carers are integral to the education setting and to the child and young person's well-being. That the setting really is the hub of its community, linking with local voluntary and community services. And that high value and significance is placed on staff well-being within the setting. As mentioned earlier, if staff are not effectively supported, they can't be expected to properly support the children and young people in their care. Then we move on to early support. And this is the early identification and provision of effective support before difficulties escalate. And it includes the provision of training and capacity building for staff in recognising signs of difficulty and how to respond. Interventions can include setting-based, group or one-to-one evidence-based programmes and will involve integrated working across education, health and community services. And then finally, then we have enhanced support. And this is when more specialist service intervention is needed for children and young people who are presenting with more complex needs, which educational settings are not in a position to provide. And now we move on to implementation. As you'll no doubt appreciate, effective integrated working between education and health in particular is central to the successful implementation of the 3-tier model. We recognise that this in itself represents a significant challenge and has therefore been the initial focus for the implementation of the framework. I'm going to elaborate on a few of the projects just to give you an idea of the highlights of this initial implementation plan. So the first one is RISE, which is the Regional Integrated Support for Education in Northern Ireland. And this is an expansion of the current RISE teams into Key Stage 2, so that they will then provide a full service across all primary schools. The RISE teams are comprised of multidisciplinary health professionals, including clinical psychologists, social, emotional and behavioural specialists, speech and language therapists, occupational therapists, physiotherapists and therapy assistants. And the expanded RISE teams will provide support at all 3 levels of the model: universal interventions targeting the wider general school population with a preventative focus, and will include whole school support, support for staff, support for parents, as well as support for children and young people. Targeted support will be provided to children who may have specific needs or felt to be vulnerable or at risk of developing particular issues. Targeted support will also be provided for teachers and parents, a consultation to co-develop an understanding of the child's presentation and appropriate support intervention when needed. Specialist support is then provided for children whose needs cannot be met through universal or targeted provision. Our second one then is CAMS, Emotional Wellbeing Teams in School. And this is in addition to the main CAMS service and is dedicated to support schools across Northern Ireland, providing direct support to children and young people, school staff and parents. They will align with the Education Authority services, the RISE teams and other professionals to ensure that there is integrated working. Similar to the RISE teams, the new CAMS service will provide support in the form of resources and interventions to strengthen capacity within educational settings and directly support staff. Indeed, the referrals for the children and young people will come directly from the educational settings themselves. The service will have an initial focus on the early support tier of the model, but will also facilitate access to the more specialist support when needed. And then finally, we have REACH, Resilience in Education, Assisting Change to Happen. And this will be delivered by the Education Authority's Youth Service, providing universal support and targeted one-to-one and group work for pupils aged 6 to 19 years, and will have a focus on preventing reducing mental health issues. This is building on the Youth Service's successful FLARE programme and is available through a referral process based on need identified by schools. Targeted support is available for specific individuals and groups, with referrals coming directly from the educational settings, as well as capacity training for education staff to develop resilient skills, and this is provided in conjunction with Ulster University. The focus is on the wellbeing for all and early support elements of the support model. As I mentioned, these are just a few examples, and there are a number of other proposals within the framework, which we are working through the necessary approval processes at the minute. So that's really an overview of the framework. Thank you again for the opportunity to attend today, and I hope that it has been helpful.
Thank you so much, Angela.
No problem.
It's a really useful overview. I mean, this has been something we've been waiting for a very long time in Northern Ireland, and something a lot of our youth groups have been calling for as well. Do you have a timescale for implementing it? What developments? I know we had a few aspects of it already that are launched. So what should we expect in the next, say, couple of years in relation to this?
What we're hoping, we have started, the REACH program has begun. Sorry, I'll just stop sharing my screen.
Yeah.
Through the Education Authority. So we started last year with that. We have the RISE program and CAMS are going to start in September. We have approvals for that. So they will launch out to the schools. And then we're working on a few more at the minute. I'm trying to think. Being Well, Doing Well is a new Education Authority service, which we hope will go out in September. We are trying to get money actually for a primary schools counselling service and to do a pilot of that next year, but we don't have the funding as yet. So that will be funding dependent. So things will come online, but we're hopeful that September will be key for most of them to come on board.
Mm-hmm. Okay, so a lot of things happening in September. We have a question from John McMullen around educational psychology involvement.
Yes.
Do you want to tell us who were, what professional groups were involved in the development of this, really?
In terms of the educational psychologists, they did support us throughout in developing the framework. And we went out as widely as we could. We engaged with universities, we engaged with the teacher training colleges, and right from inception right through to try to get as broad an input as we could. But certainly psychology support no doubt was invaluable, and Siobhan, you were very helpful in putting us in touch with your own psychologist here at Ulster University, just in getting us that important direction that we need. We do have to consider the trauma aspects of all of these things, particularly not only children who have suffered previously, but obviously in the pandemic as itself, and the psychologists were informal and very important in making that come together. Yeah,
I think we're having more conversations now around that, the need for a trauma-informed perspective. I think
very much so, yes.
In schools particularly, children's behaviour needs to be understood from that angle. What has happened to the child and what's going on in the home and the community that might lead to the behaviour.
That's it. Behaviour is communication, so that you're 100% correct.
Yeah, and even in the development of those programs that we're talking about, there's psychologists involved in those as well, and that's a very, very important part of it. So it's not just about involvement in the framework, but actually when you're looking at the programs that are going into schools. I think one of the things that has been a theme of the last couple of sessions really was the importance of good quality services.
Yes.
You know, so not just providing anything for people, but making sure that what we do whenever we're doing these frameworks is that we work and we use the evidence and we produce we produce interventions that are likely to be effective, that people are likely to be able to engage with, you know, even thinking back about the apps and that as well.
Yes, absolutely. And we're bringing together both the educational psychology and the clinical psychology end of things. And it's remarkable what they learn from one another and informing these types of interventions. So it's really exciting.
Okay, so that's great. So young people at the table, professionals at the table, and clinicians as well. Great. So what we'll do now, if Gavin's ready, hope we haven't come too early. If Gavin's ready, we could take your presentation now, and then we'll have a little, would be maybe to knock off earlier, depending on how you're set, Gavin, or maybe you could, if you want to take an extra few minutes, that's all right as well.
Thanks very much.
Okay, so Gavin's talking about the Youth Wellbeing Prevalence Study and the implications of it. Again, really important piece of work in hopefully shaping what we do going forward around young children and young people's mental health. So off you go, Gavin.
Brilliant. Thanks, Siobhan and Rhonda, for organising this and for the whole futureMINDS network. It's a brilliant development. As Siobhan said, my name's Gavin Davidson. I'm a professor of social care at Queen's. My background is in mental health social work, and I was one of the team on the prevalence survey. It was led by my colleague Lisa Bunting and the research fellows Claire McCartan, and they helped me put together this presentation. So just in terms of what I'll cover in the next 20 minutes or so, just a quick summary of the survey itself, how it was conducted, and its relevance to the futureMINDS research network. I'll cover the main findings. I'm aware that Lisa presented the findings in more depth as part of this seminar series, so I'll be covering some of the same ground. So apologies for that if you've heard that before, but then we'll get on to what further analysis is already planned and some of the possible implications for future research. Okay. So the survey itself then, it was a prevalence study of the mental health of children and parents in Northern Ireland. It was conducted by a partnership between Queen's and Ulster and the Mental Health Foundation. And it's great to see that partnership working. Again, futureMINDS is another example of that, and hopefully that will further develop. The data collection was completed by Perceptive Insight, which is a social marketing research company. Survey was commissioned by the Health and Social Care Board, and it was a big team. It's led by Lisa, as I've mentioned, with people from, as I've said, from Ulster and Mental Health Foundation. And we also had a project board with representatives of children's organisations and young people themselves, an international advisory group, and help from a group of young people through Ncb to develop a young person's version of the report. Data collection was completed in March last year, which was fortunate because it was possible to complete before the restrictions were imposed, and the report was launched in October. It's also, I guess it's one of the sobering aspects of research that things move quickly. So these findings don't reflect the sort of the accelerated developments in some areas, including the use of technology maybe over the past year. On the other hand, as has already been said, these difficulties predate COVID-19 and unfortunately will continue beyond it. If you're interested in the reports, they're available on the board's website, the links there. So in terms of what it was all about, the aim was to try and identify how many children and young people, and so just define that broadly, aged 2 to 19, were experiencing mental health problems, the type of mental health problems that they were experiencing, and possible associations with other issues. So we're hoping it does provide Northern Ireland specific information to help inform understanding of these issues and inform policy across areas, as again has been covered already. This is much broader than health and social care, obviously, and service development across areas. It involved a random sample of households in an effort for the sample to be as representative of the whole population of children and young people as possible. And in terms of how it was completed, for children aged 2 to 10, it was completed with their parent. If they're aged 11 to 15, it was the young person mainly, and some aspects by their parent. And if they were 16 to 19, it was the young person. And again, some of the parental questions, if they were available, were completed by a parent. It was mainly by interview, but a computer-assisted self-completion. So hopefully enable people to communicate more openly their responses. The response rate was higher than we had anticipated. It was 67%, and the sample was of just over 3,000 children, young people, and about 2,800 parents. In terms of the relevance to specifically to the futureMINDS research network, and in general, prevalence obviously is important, but it's only one aspect of what we need to better understand and respond to mental health problems. So the findings hopefully do inform and raise many further questions, including what has caused these mental health problems, how do these findings compare with within areas in Northern Ireland and between countries, and why, how this may change over time, and what are the explanations for that. And then fairly crucially, how can these issues be most effectively prevented and addressed? I think it's great to see in the draft strategy a greater emphasis on prevention, and that's maybe one of the sort of key themes throughout the findings, the opportunities for prevention, as well as addressing mental health problems when they do happen. Another aspect, I think, which is helpful, is in terms of thinking about why we're talking about and approaching these issues in the way that we are. That was something we're aware of in the survey. A lot of the skills we use very clinical language, which is, as Raymond mentioned, the importance of thinking about how accessible the language used is. So many of the skills we used are, I think, not that accessible. I mean, arguably some of the language used is quite problematic. So it is something we need to think about. It's also largely negatively framed. So we're really largely focusing on when people are having difficulties, and again, that in general tends to be our focus in research, and whether that should be the case or not, or whether it should be more balanced is an important question, I think. Okay, so in terms of the main findings, these first findings were across the whole cohort, so those aged 2 to 19. Strengths difficulty questionnaire, one of the most commonly used questionnaires, and that's another aspect, I guess, of the research that would be useful to hopefully to contribute to discussion around if it is possible for us to agree maybe a common set of outcome measures that could be used routinely across settings and so on. It's difficult, I think, to compare the effectiveness of services if we don't have a common, at least a few outcome measures that are being used routinely by most people. It estimated that 11.9% of the children and young people reported having emotional problems. And that was relatively high in boys aged 5 to 10 and girls and young women aged 16 to 19. In terms of specific mental health problems, the revised Children's Anxiety and Depression Scale identified 12.6% had a common mood or anxiety disorder, which we were able to compare with a similar survey in England. The finding here was about 25% higher. And again, boys aged 5 to 10, their rate was significantly higher. In terms of autism, 2 scales used for different age groups, but the overall finding was that about 8% met the criteria within those scales for autism. It was a bit higher for boys. And then the following findings were focused on the older age group between 11 and 19. Traumas, I mean, it's great in a way to see the greater understanding and focus on trauma and working out how we can help services think about those issues. So there was the finding in this survey just again focused on the criteria for post-traumatic stress disorder and complex post-traumatic stress disorder. Again, there's an ongoing debate about those issues, but in terms of those criteria, it's 4.9%. We also used a questionnaire which tries to identify when people are having psychotic-like experiences, which might indicate that they are in the early stages of developing psychosis. It's important because there have been really clear and alarming research findings about the length of time, the duration of untreated psychosis. It can be where people start to develop unusual experiences from then until they actually are able to access appropriate treatment can be very, very long indeed. And so this scale is a way of trying to identify earlier on. So Ciara Mulholland and Kieran Shannon in the Northern Trust are doing some great work around that whole area of early intervention. And it's informed by a lot of work in Australia, which has led the way, I think, in that. In terms of the scale of PQ16, about 18.7% of adolescents who reported 6 or more symptoms on that scale. So that doesn't mean that all of those people would go on to develop some form of psychosis, but it would be of some concern. In terms of eating disorders, I mean, it's not an area I've focused a lot on, but I was surprised by the high level of children and young people who reported some level of disordered eating, and specifically just over 7% who reported inducing vomiting. That was higher for girls and young women than boys and young men. Okay. In terms of deliberate self-harm and suicide behaviours, 9.4 of 11 to 19-year-olds reported self-injurious behaviour and 3.5% a suicide attempt. Again, these are important things to be aware of and alarming as well. In terms of adverse childhood experiences, again, I suppose these rates are lower than usually reported because we're obviously asking young people, and usually the reported levels are of from adults reflecting back for the period of time when they were under 18. So they are slightly lower, but still alarmingly high, I think it's fair to say. Social media disorder, again, how helpful the sort of language of disorder is, I'm not sure, but nonetheless, there is a scale designed specifically to identify when your social media use may be becoming a difficulty for you. And according to this scale, about 4.7% had a possible social media disorder, and that was higher for females than males. In terms of drinking alcohol use, just over 40% of 16 to 19-year-olds met the criteria. I think there are interesting wider societal and cultural issues for us around that. And in terms of drug use, just over 17% of 16 to 19-year-olds reported some other drug use. And again, you know, the impact of experience of bullying and cyberbullying can be extremely negative, and 16.8% of 11 to 19-year-olds reported some of experience of bullying, and that was just in the last month, and again, a similar level of cyberbullying. In terms of parents, so one of, again, I think the helpful aspects of the survey was that it wasn't just focused on the mental health of children. It also explored some of the issues that parents may be experiencing. And arguably it may not be that helpful to design services and think about children's mental health without thinking about the important people to them. But based on the general health questionnaire, it was estimated the prevalence of mental health problems amongst parents is about 22%. And children whose parents had mental health problems were twice as likely to have an anxiety or depressive disorder, again, in the language of RCADS. We also looked at parents' experiences of adverse childhood experiences. And again, of the troubles, again, this may have been naive or overly optimistic of me, but I really wasn't expecting this level of response in terms of the ongoing impact of the troubles and paramilitary activity. So 27.2% reported a moderate to extreme impact on their life, which is maybe less surprising, but 38.8% agreed with the statement paramilitary groups create fear and intimidation in this area, and almost half of 44% agree with the statement paramilitary groups contribute to crime, drug dealing and antisocial behaviour in this area. In terms of help seeking, I think this is interesting in terms of, I mean, I think as we've talked about already, the use of technology, the development of apps, the app library looks brilliant. So it's great to see more of that. But in terms of help seeking, people are still seeking help through mainly through family and friends and primary care. So we find that, again, over the last year, that may have changed, and it would be interesting to, we are now able to compare, but from this survey, 46.2% of mothers and 28.8% of fathers had accessed support services in relation to their mental health diagnosis, and GPs were the most common support service, followed by health visitors, mental health services, and family and childcare services. For children and young people, the most common sources of support for their mental health was family and friends, followed by teachers or someone in primary care. So it might inform if we're thinking about interventions where we target them. Help was sought by more children on the internet than via a helpline, telephone helpline. So 3.5% had sought. So the question was, have you sought help over the past year for some form of emotional difficulty? So it was over a relatively long period of time, but just 3.5% had sought help over the internet, and less than 1% via a helpline of some description. Okay, in terms of looking at the possible sort of relationships between variables, in terms of adverse childhood experiences, if you had 3 or more, it increased the rate of any mood or anxiety order by 8 times. In terms of age, the 16 to 19-year-olds had an increased rate, again, of any mood or anxiety disorder of 5 times the youngest cohort of the 2 to 4-year-olds. In terms of physical health, and again, it's maybe something we do need to think more about from the mental health perspective in terms of the interaction between mental health and physical health. But if there was a self-reported child health problem that increased the rate of any mood or anxiety disorder by 3.6 times. If there was a special educational need related to emotions, behavior, concentration, or getting along with people, increased the rate by 3. If the household was in receipt of social security benefits, it increased the rate by 1.7. So we didn't have a great measure of deprivation. We did some analysis using area level deprivation through postcodes, and we need to look at this in a bit more detail. And it is an issue, I think, for us in terms of our data on family level, individual level deprivation. We are able to think about deprivation at the area level, but our routinely collected data on individual and family level deprivation isn't great. And if a parent in the family had mental health problems, it increased the rate of any mood or anxiety disorder for the children by 1.41 times. In terms of planned further analysis, there's a fair bit to be done, and this is what we plan to do at the minute, although I guess that may evolve over time, but I focus on the predictors of children and young people's mental health problems, on parental mental health and substance use, on the issues of trauma and intergenerational trauma, help-seeking behaviour, as we've mentioned, relationship between parents and children's mental health, the impact of mental health on parenting, trauma history and mental health, different aspects of psychopathology, seeing if that the PQ questionnaire works well with these younger age groups. Looking a bit more at trauma and eating disorders. I think it was Niamh who mentioned about the importance of physical activity, so we do hope to look at that in terms of its relationship with parental and young people's mental health, the relationship between place and deprivation, as I mentioned, and hopefully explore a bit more with young people and policymakers and others about the implications for policy and service development. Stuff around conflict experiences, I think, is unfortunately still really important for us to focus on, and school experiences. Again, it's brilliant to see that work, Angela, developing and happening. Alcohol and drug use and mental health, including across generations, sexual identity, resilience and mental health, social media use, bullying and mental health. So there's a lot still to be done. In terms of possible further implications for research, it hopefully will help us to think a bit more about what are the priorities for mental health prevention and promotion as well as intervention. I mean, it's an ongoing evolving area about how we talk about these things and how accessible and inclusive those processes are. Importance of data, I mean, I think it is helpful to have as much data as possible, but it does need to be accessible. So my presentation of it's probably not a great example of that, but it does need to be as accessible as possible. So we do need to think about that more. And also, I mean, it's fair to say it was very difficult for us to access the families involved initially. I mean, there are available information systems which would have made that much easier and prevented the need to go just from a totally random sample of households, which obviously involved contacting a lot of households where there weren't children. So I think there are big issues about how we share and use information, including what information we collect routinely, especially about outcomes, to know if all of these great things which we're developing are actually used and useful for children and young people. There are clear issues of gender in the findings. We did ask people they could define their gender as male, female, or other. I think so it's kind of basic categories, and I guess our understanding of that is developing. But there are still issues in there about certain groups, like higher rates amongst those younger boys and the higher rates are around older girls especially. It reinforces, I think, the importance of family and thinking about how we can develop whole family approaches. If family and friends are really still the main source of, obviously, and will continue to be the main source of support for people, how we support families to respond to each other positively. The role of primary care schools and mental health services. I think we do need, I mean, it is brilliant to see the work being developed within education. I think we do need to be careful about how much we can expect schools to do. I think we do also need to focus on, focus on how we can support families to consider and maybe promote their mental health more effectively. The role of technology, as I said, I think it's brilliant to see, it's exciting, but again, we need to be cautious about that. There are really very again, surprisingly low numbers of children using helplines or the internet to access support. And there are debates around the early identification of issues. I mean, I think, as I suggested, the research would suggest really the earlier the better, especially in terms of psychosis, but really in terms of any difficulties. But we need to be careful about how that's done. And then, so the interaction between alcohol and drug use and the concerning issues, ongoing issues around self-harm, suicide, eating issues on social media, and finally, sadly, the ongoing need to think about how we address the impact of the troubles and trauma more generally. Okay, that's me. Thanks.
Super, Gavin. Fantastic, and we're bang on time, which is great too. I've been there's been some questions about the study, and this is one of the studies I have to say it's just always sitting on my desktop, open in my, in the tabs. So I have my Adobe files and that and the mental health strategy, because I use them both so much in the work that I do, pulling out figures, referring to actions within the strategy. And I put in the chat there that we the table about childhood adversities, so everybody can see the different types of adversities that are included in that scale there. Poverty wasn't an adversity in the ACEs scale that you used. Is that right, or was there a separate question on that? Growing up in poverty, did you? Because it was just the most common one in our study when we did the Northern Ireland Study of Health and Stress. It was the most common adversity.
Yeah. So neglect is in there in terms of the adverse childhood experiences included. Mm-hmm. But yes, but our measure of deprivation generally wasn't great. So we do need to look at that a bit more. So the initial analysis, which is used postcode to generate an area level of deprivation, which is really not a very, as you know, it's not a very accurate way of identifying a young person or a family's experience of deprivation. And even sort of receipt of social security benefits it's a proxy, but it's not a brilliant proxy again for deprivation. So I mean, it is surprising, I think, given the existing research about the relationship between deprivation and mental health, that we don't routinely, I'm thinking, especially from the social services perspective, we don't routinely collect data on even on income, never mind deprivation, which is, I think it's a gap. I mean, we're involved in another study which looked at child welfare interventions and the inequalities involved in those, and it framed it as sort of poverty becoming like the wallpaper of practice, that it was just, it's a constant issue, but people start not thinking about it in a way which is a concern.
Mm-hmm, mm-hmm. Yeah, and then Margaret was endorsing that as well, saying that it's the ACE studies usually don't ask about poverty. Surprisingly, the most common ACE was, well, probably not surprising at all, but surprising that it's in there as an ACE is parental separation, 35%. And the other really surprising figure there was the nearly 1 in 4, over 1 in 4 felt the troubles were continuing to affect their life, and that's really quite shocking, I think. So we'd like you to do some more analysis on that, Gavin. We'll be giving you a whole list at the end of all of this as well, because Rhonda's presentation next is going to be setting out some research priorities here. So we have a couple of points that people are making. Francis wants to know, self-reporting, would this have been to GPs, parents, teachers, or was that self-reporting in the study? Do you know what that refers to, Gavin?
I think that was just like acknowledging that we were reliant on the young person and or their parent to report these issues. So there could have been, I'm not sure if there, I mean, we could speculate. I mean, it's dangerous to do so. I'm not sure that it would be likely that there would be over-reporting of many things, but I think it might be a concern that there could have been an under-reporting of some issues.
That's always the way when people are self-reporting symptoms. And John McMullen also makes a related point. You know, we're using the language around disorders here, and what we're really talking about is symptoms that people are talking about in a survey, rather than even a diagnosis. And even the language that we often use pathologizes behaviours that are behaviours that all of us would engage in if we had the trauma and the various different histories and backgrounds of some of the children that we're talking about here. You know, so we've got to be very careful and respectful and think about the systemic and societal challenges that we're dealing with, and the impacts that they have. So that's very helpful as well. And we stand, you know, accused of that as well in the Northern Ireland Study of Health and Stress all those years ago. We were using diagnostic criteria and talking about rates of mental illness, you know, and then talking about trauma, which was actually the explanation of what was happening here. So important points. Okay, so we're going to go back. We're going to have a little bit of a break. We need at least 10 minutes. I need a quick snack. I don't know about the rest of these. So if we can come back at about 5 past, if that's all right, and then we'll have the other presentations. Thank you all so much. And I'll start recording again. The programme of work that we've been engaged with under consultation with young people in Northern Ireland, and the results from this, and hopefully this will be interesting and engaging. It's the findings from the last year and the work that Ron has done during a really difficult pandemic for all of us. So amazing piece of work. You got our slides for us.
Go in and share that. You're always worried. I remember Gail talking about how of all the things you do, the most panicking thing is making sure that your screen actually shares properly for you.
Oh, I know that's because you don't see it. You don't see what other people are seeing. This is an inherently unnatural situation. And we present this kind of scenario. We're getting used to it though, but it's really difficult when you can't see faces.
Can you see that now?
We can see you perfectly, Rhonda. Thank you.
Oh, it is. All right. So, hi everybody. My name is Rhonda Burns, and I'm the researcher on the futureMINDS project at Ulster University for Professor O'Neill and the futureMINDS team. So this is not going to be a heavy methodology session. As when the report comes out, if you really want to read that, you can. I'm just going to outline the work that we've done this year in the futureMINDS NI project and try to sum up of some of what we've discovered. Go forward. So we know there's high rates of poverty and mental illness across the population, and of course the history and legacy of the conflict in Northern Ireland still appears to be very evident. And along with those high rates of mental illness, young people are experiencing concern about the transgenerational transmission of trauma, and that's quite a mouthful, and the adversities, and mental illness in children is a cause for concern as well. So the goals for the project as set out by Professor O'Neill and the team were to bring together young people with all the key stakeholders and the researchers to promote interdisciplinary research and produce new ways of improving mental health, to set the youth mental health research agenda for young people in Northern Ireland, and to highlight gaps in the evidence base on mental health in young people in Northern Ireland. And for us, the idea behind futureMINDS is to put young people right at the core of the project, so making public engagement with young people one of the overarching aims. And the initial plan for us was to hold some mini face-to-face conferences, but again, COVID put paid to all of that. So we listened to what people wanted, and we decided that the online webinar route seemed popular, and so we set about planning some of those. And we owe such a debt to all our presenters. You can see them here. They gave up their time, they shared their knowledge, and we had lived experience shared with us from our delegates and those who joined and contributed to the conversation. So we really need to say thank you to all of you. And I'm not going to go back over the webinars blow by blow. As you can see from the recordings for the webinars are on the futureMINDS NI YouTube channel. And in time, in the time that we have, we really couldn't do justice to the importance of those conversations, is what we need to say there. So one of the other strands of the research for the Future Minds is the transgenerational transmission of trauma. And there is considerable evidence that trauma can wreak havoc physically in the body. Bissell van der Kolk, in his publication, The Body Keeps the Score, argues that experiences such as childhood neglect, sexual or domestic abuse, or even war, for example, can have a real detrimental impact on physiology. And there's always been two opposing views about the development and maintenance of behaviours, the sort of Darwinian and Freudian side, not only about single individuals, but really across generations. And years ago, I came across a really interesting online article. It was titled "Grandma's Experience Leaves a Mark on Your Genes." It was a really simple explanation of how life experiences could directly impact human physiology, but not only your own life experiences, but those of your mother, your grandmother, and even beyond. But unfortunately, here in Northern Ireland, there's been very little done to explore this. And indeed, we conducted a literature review and found that only 7 published papers examining transgenerational transmission of trauma in a Northern Ireland population existed, but none of them explored the physiological impact to identify biological markers for trauma transmission. So we wanted to understand how could we study this in Northern Ireland. And we've undertaken a pilot study using online focus groups to ask young people what mental health and wellbeing mean to the young people in Northern Ireland, what they understand about transgenerational transmission of trauma, if anything at all, and also would they be willing to give biological samples for this type of research, and if so, what samples would they give? And we also wanted to know if they thought their parents or grandparents might do the same thing, and how their family and they would feel about answering the difficult questions about trauma experiences across their life. So we have some preliminary data, but we're still data collecting at the moment. And some of the young people feel they're still living the impact of the Troubles. They express that there's a fear in some environments that they can't cross into certain other areas and certain other communities, that they just don't want to go into them. While other young people were telling us how they hear stories from their parents and their grandparents, and the whole Troubles seems like a real foreign concept to them. They also felt that any research we were doing had to be open and fully outlined to participants, and that they felt that samples of saliva would probably be the easiest to collect for this type of research when compared to blood samples, which they felt were more medical or diagnostic type samples. And when it came to feces samples, well, they felt people might feel uncomfortable or embarrassed about that. So they really didn't want that to go ahead. They felt that recruitment as well might be aided by incentives, but they felt the most likely way to recruit would be through the influence of the person who was asking. So if a young person themselves were involved in the recruiting of their older relatives, this might increase the participation. But they did express concerns around the logistics of collecting samples, as many people may find it difficult to actually take part around their work commitments, around their other commitments as well. So we need to take that into consideration. And when we asked them about what mental health meant to them, they raised the issues around stigma and mental health. The impact of social media on mental health was mentioned, and how having a mental health issue can also include not just feeling unwell or feeling ill, but a lack of feeling anything. And they also said that good mental health for them meant being able to get on with their daily lives without any kind of impediment or, having to think about it. So there's some positives and some negatives in the first of our pilot studies, but certainly some very important information going forward. The second strand of the pilot studies was looking at chatbots or digital mental health apps. And we've heard this morning from Sue all about the work that they're doing. So mental health and wellbeing needs of young people we know are not being adequately met. And as Professor Mulvena outlined in one of the first webinars, young people are the main consumers of the digital world. and the information that they're seeking online in a health topic would be stress, anxiety, and depression. And that's the most searched health topics by teenagers online. So developing digital mental apps may be key to providing resources for young people in the future that offer young people exactly what they want that will meet their needs. But in order to do that, we really need to understand exactly what the young people want from an app and how they would use it. So what are we doing in this part of the project? Well, again, we're holding online focus groups because COVID doesn't allow us to meet up. And with the young people there to help us understand what good mental health means to them, their perception of what it means to have a good quality of life. And we also showed them some different chatbots to understand what they feel works for them and what they didn't like, and to ask them if they were going to use a mental health app, what would they want it to have as a personality, if they wanted to have it as a personality. So what were the key factors in a chatbot? So again, we're still collecting data, so these are preliminary results. But in the focus groups, the young people were very aware that their mental health has an impact on their physical health and vice versa. And some had described that if they were not feeling the best and they didn't want to engage in their daily activities, they maybe didn't want to go for a walk, but equally for those who were involved in competitive sports, that any injury that impeded their ability to join their team had an impact on their mental health as well. They also felt that relationships were key to maintaining positive mental health. And one participant who was living away from home during the lockdowns basically said, I miss my pets. So they're thinking about all sorts of relationships, not just with their families and their partners, but relationships as a whole, who or what they have connections to. And we heard from the young people how important it is to be able to look inwards and to realize that they might be struggling. So the value of introspection for them, it was highlighted very much. The young people also felt that there's a lack of available mental health support, with services having incredibly long waiting lists, and a perception that GP services are too quick to prescribe medication for many different conditions. So in relation to technology, the young people felt that the pandemic had increased their dependence on the technology. They felt that they'd been in front of screens for a long time for the year, and which for some had actually highlighted and increased their feelings of isolation. For others, it had highlighted their ability to be able to stay connected with their friends and families. But the young people also identified one potential barrier to technology for those with learning differences such as dyslexia, or for some with physical disabilities that make it difficult to use technology. And that is that all chatbots rely on text strings. So when you engage with a chatbot, you type things into the platform and it comes back and you type something else. And they had suggested that a speech to text utility embedded in these systems would be very, very helpful to break that barrier down. Again, preliminary results because we're still collecting data, but we showed the young people some chatbots, how they work, what the platforms are like, how you can engage with them. And we asked them to rate the chatbots on a scale of 1 to 7, where 1 was strongly disagree and 7 was strongly agree on how they felt the chatbot could meet their requirements. We also asked them to rate their thoughts on how easy to use the chatbot would be. And again, on a scale of 1 to 7, where 1 was strongly agree and 7 was strongly disagree. So you can see here, when asked, does this chatbot meet my requirements? Youper had the top score in that. And when the chatbots were asked, or when the participants were asked, is the chatbot easy to use? Youper again took the top place. And we only showed 4. We showed ChatPal, Youper, Replica, and Wissa. And there are others out there, but that was a really good indication that they liked the Youper platform. Okay. We then asked, using the big 5 personality traits, which we also know is the Ocean model, what do young people want from a chatbot? And we asked them to rate from 1 to 10, where 1 is low on an index and 10 is high on an index: openness, conscientiousness, extroversion, agreeableness, and neuroticism. And they felt that the chatbots should be moderately open, quite conscientious, more extroverted than introverted. They wanted the chatbots to be very agreeable and to be calm. So really informative to take this work forward. So our final piece was a consultation with young people. And the core of the project is engagement with young people. And if you want to know what young people think, you really just need to ask them. And we wanted to understand what young people themselves felt that we needed to know going forward. So what were their priorities for research? And we needed help from them to set the agenda for mental health research for young people in Northern Ireland. So we launched the online consultation to set the agenda for the mental health research for young people through Twitter, through Facebook, and through Instagram, and to ask the young people who live in Northern Ireland between the ages of 11 and 25 a simple question. In your opinion, what do you think is the most important question that researchers should be trying to answer about the mental health and well-being of young people in Northern Ireland? And the consultation was open from January to March. We had a total of 479 young people engaged in the consultation. It resulted in 279 questions that we then grouped by theme. And this gave us 12 areas of concern. And I'd like to take you through these now. Okay. The 12 areas of concern will be translated into full research questions with the help of the futureMINDS team and a youth steering group. And we'll ask that youth steering group to rank order the most pertinent research questions to be answered for young people. So the first question that we find, the first area that we find was, how do we establish the causes and extent of mental health difficulties experienced by young people in Northern Ireland? So here the young people were asking, how does mental illness start? What are the triggers? How long can it go on for? And what are the implications for them if they happen to suffer a mental health problem in their future education and their future careers? They also asked about how mental health literacy, resiliency and coping can be integrated across the entire school curriculum at primary and post-primary level. So the young people are asking for this to be introduced into the schools as soon as possible, because they seem to want the tools to help themselves and support their peers. Now, they're in no particular order, but the third one was, what is the impact on mental health and well-being in young people when a whole school approach model of positive mental health and well-being is embedded in the school ethos and in all practices? And it was actually great to hear from Angela this morning about the work that's progressing along those lines. And this is what the young people are asking for. They want the information, they want skills and training and all of that to be embedded in the curriculum right from the early years. Okay, so how can we ensure that young people in Northern Ireland feel that their voices are being heard? Well, not only do we need to listen and acknowledge what they're saying, but we also need to make sure that they action the research. And this is what young people are telling us. Don't just do the research and leave it on a shelf. Bring it forward and tell the people that matter, the policy makers, those that are in a position of provision for the young people. This is what we found and this is what needs to happen. They wanted to know what are the factors affecting the perceived safety and confidentiality in mental health and support services for young people as well. So young people are telling us that they don't feel like they have a safe space to discuss their issues. And they're asking for that space and support that's confidential, so they can work out their problems and the feelings that they're experiencing for themselves. But we should provide a range of evidence-based services for young people, both within and outside the school environment, that will allow young people the choice in how they access services. We also heard what are the factors that influence presentation to services or service access for young people in Northern Ireland. And this does seem to go back into the previous question, and we were constantly told it's about confidentiality and it's about having a safe space to be able to explore who they are, explore their issues, and not feel judged, or that they're going to be, you know, immediately their parents are going to be informed or anything like that. The next one was, how do we ensure mental health services are timely and adequate to meet the needs of young people, and that the efficacy of the services is assured? So young people really want to be able to access services at the time of need, not to be put on a waiting list and not to be sort of left to the side. And they need those services to meet their needs in a way that works for the young people. And then we heard, what are the key components of a person-centered service? So the young people want support that is specific to them, to their experiences, and not for them to feel like they're in a situation where the support that they receive comes from a one-size-fits-all, based on perhaps a clinical diagnosis or something that's not specific to them. And what can we do to make young people in Northern Ireland feel less isolated, lonely, or marginalised was another area of concern that arose. This is an interesting one, because while many of the young people raised issues surrounding young people who identified as LGBT+ or BAME, it was also very noticeable that many of the young people were talking about just individuals who seem to be really lonely or isolated in general. So there are issues of loneliness and isolation in the population of young people, and we need to take that into account. So here we are on the 10th one. How can we improve engagement with and management of social media for young people to improve the positive impact and reduce the negative impact? Again, this was really interesting. Quite a few of the young people mentioned the negative impact of social media on their health and well-being, but there were several who also talked about how social media can support their mental health by reducing isolation and loneliness, and that social media had helped them over the pandemic. So we need to look at how we can ensure that young people are using and managing social media safely online, that does good rather than making them feel worse. So this was one of the key areas that seemed to come up time and time again. So that was, how do we reduce the impact of stress experienced within the education system for young people in Northern Ireland? And there has been a lack of cohesive leadership across the education system during the pandemic. But a key point here for me was the way that children went back after lockdown. They went straight into exam mode, and that sort of feels like a breach of trust. Professor Rory O'Connor talked about this in the suicide and self-harm webinars. And he said young people are telling us that they're under so much pressure to achieve academically, that they're studying really, really hard during the school day, and they're studying really hard in the evenings, to the point where they have next to no downtime, no time to talk to friends or spend time with family, or some even saying that they simply don't have time to go for a walk and clear their heads. And we as adults talk about that as our work-life balance. And the young people are feeling the stress building around this. It's also interesting to know, are the schools too fixated on academic achievement to the detriment of supporting young people to become well-rounded and happy individuals? So it's very interesting that this is something that the young people are definitely very concerned about. So the final one is, what is the impact on young people who cannot maintain or access resources to maintain their healthy, balanced lifestyle? And again, taps back into the previous question, but many of the young people talked about what, as I said, what we as adults would frame about their work-life balance. Some are struggling to have access to green spaces. Some are struggling just to find a way to take that downtime and take time for their own self-care, because they are so caught up in studying, and their academic achievement seems to be putting a lot of pressure on them. Okay, so really, how do we conclude the project? How do we tie this all together? Well, I have to say we definitely owe it to our young people to ensure that we're listening and to build an extensive evidence base of what works for young people and what doesn't. And we need to be guided by the young people themselves. We need to ensure that the research is active and that it informs policy to make a difference for young people. And the findings from futureMINDS research have been doing, it really resonates with the findings that we heard this morning from Niamh from the Northern Ireland Youth Forum about their research. And it also feeds into what Angela discussed as well. So going forward, there's two areas that seem to be repeatedly coming up for the young people, and I really wanted to share those with you today. So young people need access to mental health services at the time of need. But how do we make that a much more achievable aim? So it may be achieved through blended digital mental health services. So even something like the Text to Nurse initiative, which I heard about just the other day. But we need a variety of access points for young people that work for them, spaces that they feel are safe, so that ultimately more research can be done and to understand what will work for young people, and to ensure that any provision that we do make meets the needs of the young people. I also think we've talked a few times about a whole school model approach to mental health. So mental health, well-being and inclusion, early interventions and training across and embedded in the curriculum for all pupils from preschool and the early years right across primary school and into the secondary level. Because the young people are asking for training and information on resilience, coping skills. They want awareness of the mental health issues. They want the inclusion of relationship and sexuality training and information and education, because we live in a diverse society. And with tolerance and empathy to help young people, for LGBT+ communities and for those with disabilities, where schools can also create safe space that young people feel they can be themselves, they can explore who they are as they mature at a time when they don't necessarily have the answers for who they are, and they don't often have the language or the labels to express how they feel. So an educational system is fit for purpose to prepare our young people, not just academically, but personally, socially, and culturally, for a healthy and happy life in a diverse community beyond their school years, into their adult lives, into their careers. And it was really exciting to hear the work outlined today, what Niamh has said and what Angela has said, addressing some of the main questions that we have found that map on to the things that they're also working on. But we need to figure out, how can we make this happen? How can we ensure that schools are supported and have the tools to deliver this so that it's embedded in the curriculum right from the early years across? So lastly, it just remains for me to say thank you. And there are so many thank yous. Working on this project has been great. Professor O'Neill has been fantastic support, as have the entire futureMINDS team. But I specifically want to thank the young people who have talked to me across the various work packages that we have been running this year, and just to thank them for being so candid in sharing their thoughts with me. The report will be out very, very soon. We have lots of links to the webinars and things, and I'm going to put all that out later in an email for everyone. So thank you for listening as well. That's me done.
Thank you, Rhonda. That was brilliant. What a lot of work you packed into a short presentation. So thank you so much.
It's a bit of a whirlwind, so I apologise for that.
Yeah. So we're now going to hand over to Colm and Elaine, who are going to tell us about our bootstrapping awards and the results from that. So I see Colm has his camera on, so we'll let you go ahead, Colm.
Yeah. Hi, Siobhan. Yeah, thanks very much, Rhonda. And I'll just try sharing my screen here. Hopefully we can get that up.
So,
okay. So hopefully you can see that okay there. I'll just start this very short presentation. So yes, thanks very much for that. It's been very interesting to listen to the talks today. And I just wanted to announce our Bootstrap Awards and just tell you a little bit about what they were. So what the awards were small grants really of £500 to youth-led initiatives addressing mental health issues. And they were embedded as part of the futureMINDS MRC project, and there were 5 of them available. The idea was that they were sort of a by your bootstraps, bottom-up approach, so that people could come forward with their own ideas and that we could try and help them get them maybe off the ground. It's not a lot of money, but it is something concrete, and we thought we could maybe use this as a way of directly supporting people. So the projects needed to demonstrate that they were youth-led, address young people's mental health, robust and inclusive. And we had a fairly simple online application, well, at least I hope people found it simple, online application process run by the omnipresent Rhonda, who seems to be able to do everything at once. The applications were judged by a small panel, including some youth representatives as well. So really the idea behind it, as we said, we sold it to the Medical Research Council, was that these should be youth-led initiatives on the theme of adolescent mental health. They should be driven by young people and engage their peers in novel and constructive ways. And they needed to promote issues relating to mental health of most interest to them. And that's not always for us to say. I mean, it's very easy to come along and say, look, this is what we think the problems are that young people have, and we want them to do this or that. And we wanted to give people an opportunity, as in the rest of the project, really, for them to have their own voices and to be able to say themselves what they're most concerned about, perhaps do something concrete about it. And in addition to these stated aims, really, what we were thinking was that this is a sort of a concrete and tangible contribution to youth-led work promoting mental health. And I know it's a small amount of money, but it also is the chance to promote and highlight these initiatives locally. And also with the funders, the Medical Research Council, it's a very big, really powerful funding agency in the UK. And really it's part of a sort of a drive to highlight mental health issues and the importance of mental health. And I think this is, of course, prior to COVID, we started all of this, and really during the pandemic, that this has only become more and more of an issue, of course, as we've seen with the presentations today. And as I said, we were anxious that we should have some sort of a concrete and tangible contribution, as Niamh was saying earlier from the Northern Ireland Youth Forum. What is it that we can do for you? It's not a great deal here, of course, partly because the funders are sort of restricted in refurbishing funds through their main channels, but it was some way to kickstart maybe some of these smaller projects. So without really any further intro, then I'm just going to go through our winners. So we had 5 awardees. The first one is called Brogue Grey. It's a mental health champion workshop. It's being a series of workshops and group activities for dealing with mental health stigma, attitudes to mental health and depression, how to deal with social media. And it's being run by HSCNI through North Belfast youth clubs. It's an ongoing program that they had already set up, but couldn't really get going because of COVID. And we're happy to be able to help them to get it off the ground. It'll be mostly helping people in the 13 to 19-year-old bracket, and it has, as I said, it's an interactive. And we thought that was also important, particularly now as things are returning to normality, and we should be able to get more activities off the ground as well. The second award is to Pure Mental, which is the name for a charity group who are working with the developing mental health toolkits for schools, and they're developing a series of booklets and posters and also interactive workbooks. They're aiming mostly in this pilot phase for the youngest age groups in P1 to P3, but they're hoping to expand to older children, and it's targeting really schools across Northern Ireland. And I'm happy to say the main applicant, Matthew Taylor, is with us. Maybe Matthew might like to say a few words more about what the project will be doing.
Thank you very much for that. I just wanted to say, first of all, thank you very much to Siobhan and Rhonda and everyone else in the team. As you know, Pure Mental's been on for quite a while now, and we're sort of hitting our stride now. We actually got our charity registration sort of form through on Friday. We're registering on Monday, so that's obviously very exciting. I also wanted to say thanks to Rhonda for her outline of the presentation with the 12 questions. It seems to me that was very comforting for us, because they're the questions that we are trying to address, and it was great to see that is the general consensus. I don't want to say too much more on the toolkit project, because I'm sure you've all heard enough about what that's been about recently, but I just wanted to say thank you. So thank you.
That's great, Matthew. Thank you for speaking for a few words there from Pure Mental, and we wish you all the best with the project in going forward. And it's really exciting about your registration coming through as well. The next award was to the Well-Connected Ambassadors, which is a series of youth-led workshops, and these were run by the Bogside and Brandywell Health Forum, and they're aimed mostly at these sort of transition years between P7 and Year 9. They're face-to-face and interactive, and are aiming at looking at or talking about coping with mental health issues, relationships, and also health in general. And they are not just talking workshops, but also cooking, which is good. And it's nice to see active activities as well in there. And we're very pleased to be able to help them to get these primarily peer-led workshops, which are supervised by members from the BPHF and run in schools, and that these are really led by the kids as well. So another really good and worthwhile initiative. Our fourth award is the CloudMind app, which is actually another BPHF initiative, but through a separate group. And here they have been developing an app in consultation with young people. And this, we've also built their own website, and it's involves it's an app for the phone which can give wellbeing advice and provides healthcare links, and works well offline as well. It is aimed primarily at people. It's been developed by people mainly in the Jerry Strabane area, but they're hoping to roll it out, of course, to a larger and more general audience. And of course, apps and chatbots were dealt with earlier in the workshop, and I'm sure there was a lot of interest there in Sue's talk for the CloudMind app group. And I know that Orla Robson, who is the main applicant, is also with us. Orla, maybe you'd like to say a few words as well.
Yeah, sorry, I hope you can all see me there. Yeah, no, we're very, very grateful to get the funding. Our young people worked really hard during the last lockdown that we had, and they focused their time into developing this app. And the app itself gives young people a section on well-being, which the young people felt was important. And there's little things that they wanted separated, like gender and sexuality. They wanted that separate on the app. They found that was two very different things. So it was very much led by what they wanted to put on there. And then what they also found was they knew there was a lot of support out there, but they were very confused about who did what and direct links, and they wanted some areas of support available where you could just like text the nurse, for example, or you could do anonymous messaging, which there's quite a few of. So they compiled all those into like a support directory, separated out into need. So if you need immediate need, what services you can go for. If you've got an eating disorder, what you could go for. So yeah, so this funding will hopefully help us now get it onto the App Store and get it launched in all the schools across Derry. So they'll be absolutely buzzing. Thank you very much.
That's great to hear, Orla, and we're so pleased as well to be able to support these initiatives. And finally, our last award goes to the Welcome Back Wellness, which is again a series of activities and workshops aimed at students mainly in the Down Patrick area, but hopefully this is something that the best practice can be reported and maybe rolled out to other schools as well. But this is looking at mental health, the problems that are incumbent with the pandemic, and also physical health as well. As we know, the two really go hand in hand. And it is an interactive and face-to-face, and others fantastic to keep a broad spectrum of activities going. It's good to have both real-world active and also that all-important support via apps and chatbots and other digital means as well. Okay, so really that was all I had to say. So I'm going to hand back there to Siobhan, who was going to lead the final discussion.
Thank you so much, Professor Walsh. That was excellent, and thanks for leading the Bootstrap Award process. I had no idea who was going to receive the awards there. I have been disconnected from that side of it, but I'm just so delighted that there's a good range of projects there. I'm familiar with some of them, really youth-led and just showing what can be done when young people come together and decide for themselves what to do, and that the ideas and the energy are just great. So I think that's just been fantastic. And for those of you who don't know Professor Walsh is a biomedical scientist at Ulster, studies methylation. So we're designing studies together around transgenerational trauma and all of that. So I just think it's so wonderful that these events are linking together young people with scientists who are studying mental health and in lots of different ways at our universities. So that's great as well. So have a look up Colm and you'll see some of his papers and the work that he does. So thanks again to Colm and Dr. Liam Murray as well, who was involved in that process. Super. So we have only about 10 minutes left for any questions that people might have to our presenters today. So I'll have a wee look at the chat. Is there anything coming up there? Yeah, somebody's asked about the report for the futureMINDS report. We will be publishing that, and we'll get everybody who's on the mailing list, if we're allowed to do that, Rhonda, for GDPR and all of that stuff. If it's possible to do that, we will do it and send it to you directly. If not, I'll put a link on my Twitter feed, and we'll put a link on the futureMINDS Twitter feed, and we'll be able to contact you that way. So that's probably the legal way of doing this nowadays. But we do plan to share the report with everyone. More importantly, we will be working on those 12 areas now. So the next few sessions, we're going to refine them so that we translate those areas really into research questions that need to be asked, and then we will be bringing those research questions to the funding bodies, to the government through me, and then also in all sorts of other ways, so that we highlight what research needs to be done. And I think those areas, again, there's a few different documents out there where young people have identified what the priorities are, and we are hearing the same things again and again, and really, you know, it's time the government really took a look at these things and were answerable. So we'll be bringing them to the Children's Commissioner as well, and Kula's team are doing a lot of work there and holding the government to account for acting in all of these areas to improve children and young people's mental health, and also to improve services for people. So that's good as well. So let me have a look. Anybody got any questions that you just want to turn on your video and ask a question? Oh, no, everybody's very shy. We will be putting the slides we'll be asking the presenters first, but if they agree, and most people do whenever we're doing this sort of free stuff, we'll be able to get the slides to everybody as well, one way or another too. Okay, anybody got any burning questions from today? We should also send you copies of, or a link to copies of the report that Professor Gavin Davidson was talking about there as well, the Children and Young People's Prevalence Study. Again, a really, really important piece of work, and to the Department of Education's framework for mental health and wellbeing in schools, and to the Northern Ireland Youth Forum report as well, if we can. You know, we'll get all those out to everybody too. Okay. We have one new message. Ah, that was just from you, Rhonda. I got all excited there thinking there was a question. Okay, well, we've had a very long session today, so we can leave it there if there's no questions. And you know, we can contact any of the presenters today and the other webinars through Rhonda. Rhonda will be able to get you their details and get messages to people if you have any key messages that you want to ask or transmit or tell any messages for people, or any questions, we can get those answered for you. So thanks so much for joining us today. Our next sessions will be policy roundtables, where we'll be really thinking about translating all of these issues into practice and policy, and changing things that happen, and talking to government departments and elected representatives about how we can do that, how we can really change things to improve young people's mental health and well-being, and get more research done so we understand it all more. So watch out for those. They're really exciting. We've had some confirmations just over the last couple of days, even hours, so that's good too. So thank you so much, everybody, and I will press pause.